Every year, roughly 10 million people are affected by stroke, making it the second greatest cause of death, disability, and the requirement for long-term rehabilitation and care in industrialized countries. But what is more surprising is that the number of strokes is expected to rise by between 60 and 80% by the year 2050, making it an epidemic. In today's video, we will delve deeper 7 symptoms of stroke that you need to be aware of to protect your heart from danger. But before we start, let's first understand what a stroke is. A stroke occurs when a blockage or bleed of the blood vessels either interrupts or reduces the supply of blood to the brain. When this happens, the brain does not receive enough oxygen or nutrients, and brain cells start to die. There are 2 types of stroke in general. Ischemic stroke occurs due to blocked or narrowed arteries. Treatment tends to focus on restoring an adequate flow of blood to the brain. In contrast, blood leaking into the brain may cause a hemorrhagic stroke. Treatment focuses on controlling the bleeding and reducing the pressure on the brain. You must keep in mind that a stroke is a medical emergency. Although many strokes are treatable, some may lead to disability or death. Now, let's find out the symptoms of strokes. Experiencing paralysis before a stroke often indicates the occurrence of a transient ischemic attack, a temporary blockage of blood flow to the brain that may manifest as sudden, brief episodes of paralysis on one side of the body, known as hemiparesis. This sudden weakness or paralysis is often localized to the face, arm or leg, and is a stark signal from the body that a more severe stroke could be imminent. Moreover, the basal ganglia, a group of structures deeply seated within the brain that assist in regulating movements, may also be affected during these episodes, further contributing to the manifestation of paralysis. The body's alarm system, in essence, is signaling through these episodes of paralysis that the brain's vascular health is compromised. In a study of 26,800 individuals, analysis showed that participants with darker skin shades had a significantly higher likelihood of experiencing unilateral numbness compared to participants with lighter skin colors, highlighting a racial disparity in this stroke symptom. Consuming 1 medium-sized potato per day, preferably with the skin on for more potassium, may help keep blood pressure levels in check, minimizing the risk of blood flow disruptions to the brain. Difficulty walking before a stroke often signals a transient ischemic attack, where a temporary lapse in blood flow to parts of the brain affects its motor control functions. Specifically, regions like the cerebellum, which oversees balance and coordination, and the motor cortex, which directs voluntary muscle movements, may be affected during a TIA. When these areas do not receive enough blood, the body's ability to coordinate movements, such as walking, becomes impaired, leading to a sudden, noticeable difficulty in maintaining balance or moving smoothly. Moreover, the underlying conditions that lead to a stroke, such as hypertension, diabetes, and arterial disease, may cause systemic changes that impact blood flow both to the brain and peripheral areas. Over time, these conditions may lead to peripheral artery disease, affecting the leg's blood vessels and further complicating the act of walking due to pain or discomfort, known as claudication. In a study of about 1,100 stroke patients in Sweden, it was found that both pre-stroke physically active and inactive groups improved significantly in mobility, walking ability, and upper extremity function during their hospital stay. However, there was a slight trend towards faster recovery in the physically active group. To mitigate the risk of stroke and improve overall vascular health, incorporating foods rich in antioxidants, omega-3 fatty acids, and fibers may be beneficial. Fatty fish such as salmon, mackerel, and sardines, rich in omega-3 fatty acids, should be consumed at least twice a week to help reduce inflammation and improve blood flow. Unexplained fatigue, often described as an overwhelming tiredness not relieved by rest, may be linked to stroke. Factors like hypertension, atherosclerosis, or heart disease may impair blood flow, leading to an inadequate oxygen supply to brain cells. Since the brain governs energy levels and alertness, Any compromise in its blood supply may manifest as fatigue. This condition not only signals a decrease in the brain's functional capacity, but also may indicate an increased risk of stroke, especially if the brain's blood supply is further compromised. Additionally, conditions that heighten stroke risk, such as hypertension, diabetes, and high cholesterol, may independently cause fatigue by affecting the body's metabolism and the efficiency of blood circulation. The body's effort to compensate for these vascular challenges may deplete energy reserves, leading to a feeling of exhaustion. In a study of 115 patients who experienced their first ever stroke, the findings revealed that 30% had pre-stroke fatigue. Post-stroke, 24% experienced severe fatigue, with a higher prevalence in women. To combat fatigue, incorporating spinach into your daily diet may be highly effective. Packed with iron, spinach improves oxygen transport in the blood, which is essential for energy production and efficient brain function. Consuming at least 1 cup of fresh spinach or half a cup of cooked spinach daily helps ensure the brain receives the oxygen it needs, reducing the risk of fatigue associated with diminished cerebral blood flow. Cognitive impairment before a stroke, often seen as a precursor to vascular dementia, may occur due to the gradual narrowing or blockage of arteries that supply blood to the brain, a condition known as cerebrovascular disease. Over time, this reduced blood flow may lead to brain cell damage in areas critical for memory, decision-making, and attention, manifesting as cognitive impairment. The process typically starts with risk factors such as hypertension, diabetes, high cholesterol, and smoking, which contribute to the development of atherosclerosis, the hardening and narrowing of the arteries. As atherosclerosis progresses, it may lead to small, unnoticed strokes or silent strokes which cause subtle brain damage. Repeated instances of these silent strokes may accumulate, leading to noticeable cognitive decline. Furthermore, the brain's white matter, which is responsible for transmitting signals between different brain regions, may be particularly vulnerable. Damage to white matter due to poor blood flow or microbleeds disrupts the brain's communication network, further impairing cognitive functions. In a study of 337 patients aged 55 to 85 who were evaluated 3 months post-ischemic stroke, 9% showed signs of cognitive decline, including dementia, prior to their stroke. Walnuts are excellent for combating cognitive impairment due to their rich content of alpha-linolenic acid, or ALA, a plant-based omega-3 fatty acid that supports brain health and cognitive function. Eating about 28 grams of walnuts daily, which equates to a small handful, may improve memory and cognitive performance, thereby reducing the risk of cognitive decline associated with stroke. Experiencing dizziness may arise from transient ischemic attacks, often dubbed mini-strokes, where such disruptions are temporary but significant enough to affect the brain's equilibrium. The cerebellum, situated at the back of the brain, fine-tunes motor control and balance. Meanwhile, the brainstem, connecting the brain with the spinal cord, integrates and relays information between the brain and the body, including signals crucial for maintaining equilibrium. When blood flow to these regions is momentarily reduced or blocked, perhaps due to a clot or narrowing arteries, the immediate outcome may be a sense of dizziness or vertigo, signaling that the brain's communication lines for balance are temporarily out of service. In a study involving 140 patients with a history of recurrent stroke or transient ischemic attack, 21% recognized sudden trouble with walking, loss of balance, or dizziness as warning signs of a stroke. Bananas, as a prime source of potassium, aid in regulating blood pressure and improving blood flow to the brain. 1 medium banana daily is recommended to maintain adequate potassium levels for vascular health. This symptom may manifest as a sudden lack of coordination, difficulty handling objects, or an unusual unsteadiness in movements. The cerebellum, located at the back of the brain, fine-tunes motor activities, ensuring movements are smooth and coordinated. The motor cortex, on the other hand, initiates voluntary muscle movements. When either of these areas experiences reduced blood supply due to narrowing arteries or temporary blockages, their function is compromised. These episodes, while temporary, are often indicative of a stroke, serving as a warning that the brain's vascular health is at risk. However, you must know that physical activity impacts heart health. A study with 100 patients found that physical activity was the only important factor that changed the risk of cardiovascular disease. Do you know that berries are rich in antioxidants and flavonoids, which improve coordination and motor control? Regular consumption of at least half a cup of fresh berries daily may help maintain the health of the cerebellum and motor cortex, reducing the risk of clumsiness associated with brain function disturbances. Before a stroke, a person might experience vision problems due to transient ischemic attacks, which temporarily reduce blood flow to the areas of the brain responsible for visual processing. This reduction in blood flow may lead to symptoms such as blurred vision, double vision, or even temporary vision loss in one or both eyes. The visual disturbances occur because the occipital lobe, the part of the brain located at the back of the head that is crucial for interpreting visual information, isn't receiving enough oxygen-rich blood. In a study of 10 stroke patients, 7 experienced hemianopia, affecting half of their visual field. 2 others had hemianopia with neglect, ignoring the affected side, while 1 patient reported diplopia double vision, and another had vision loss in one eye, highlighting hemianopia as the predominant visual impairment post-stroke. Eating 1 medium-sized carrot daily provides a significant amount of beta-carotene, supporting the function of the retina and other parts of the eye, and potentially reducing the risk of vision problems associated with stroke. Difficulty swallowing, medically known as dysphagia, before a stroke may be an alarming symptom. The cortex, brainstem, and cranial nerves work together to manage the complex sequence of movements that allow for the safe passage of food and liquids from the mouth to the stomach. When a stroke occurs, it may temporarily compromise the blood flow to these critical areas, affecting their ability to send and receive the necessary signals for swallowing. In a study involving about 400 patients with ischemic stroke, 41% experienced dysphagia. Analysis identified significant associations between dysphagia and factors like pulmonary infection and aphasia. High in healthy fats and fiber, avocados support nerve health and the smooth functioning of muscles involved in swallowing. Eating half to 1 whole avocado daily provides a healthy dose of monounsaturated fats and fiber, facilitating brain-muscle communication necessary for swallowing. Difficulty speaking before a stroke, often termed dysarthria or aphasia in more severe cases, unfolds in a series of steps tied to the brain's complex network of neurons and blood vessels. The onset of ischemic attacks, commonly known as mini-strokes, causes blood flow to the brain's language centers, usually located in the left hemisphere, including Broca's area for speech production and Wernicke's area for language comprehension, to be momentarily reduced. Thus, the lack of oxygen and nutrients to brain cells in these critical areas impairs their function, manifesting as slurred or garbled speech, or even the inability to speak. Although the effects are temporary and typically resolve within minutes to hours, they indicate significant blood flow issues that could lead to permanent damage in the event of a full-blown stroke. A study with 936 acute stroke patients found that 82% of these patients experienced speech issues upon admission, primarily dysarthria, which affects muscle control needed for speech, and aphasia, a condition that impacts the ability to understand or produce speech. Notably, patients with speech disorders had a higher mortality rate. For those experiencing difficulty speaking, flax seeds may be incredibly beneficial. High in omega-3 fatty acids, particularly ALA, flax seeds help maintain the health of the cerebral cortex, the brain area responsible for speech. Incorporating 1 to 2 tablespoons of ground flax seeds into your diet each day ensures optimal absorption of these nutrients, aiding in speech and language processing. Before a stroke, a person may experience a severe headache due to a transient ischemic attack (TIA) or a sudden increase in blood pressure that affects the brain's blood vessels. In the case of a TIA, the temporary reduction in blood flow may cause discomfort as the brain's oxygen supply is momentarily disrupted. Additionally, if the stroke is a hemorrhagic stroke brain, bleeding, the blood leakage may raise the pressure inside the skull and cause a sudden, excruciating headache. The headache is a result of the brain and its surrounding tissues reacting to the disturbance in blood flow or the presence of blood outside the blood vessels, signaling a critical condition that requires immediate medical attention. In a study of 263 stroke patients with an average age of 76 years, researchers found that about 19% experienced new-onset headaches, while severe headaches showed a slight trend towards being associated with vertebrobasilar ischemia overall. Keep in mind that our diet is the key to robust health. Spinach has a high magnesium content, which helps relax blood vessels, preventing their constriction and the resulting headaches. Consuming at least 1 cup of fresh spinach or half a cup of cooked spinach daily may contribute significantly to the magnesium intake required to mitigate this risk. Recognizing these symptoms early and seeking immediate medical attention may significantly improve the outcome for someone experiencing a stroke. The brain is a complex organ, and its health is crucial for the functioning of the entire body. Awareness and prompt action may make all the difference in preventing long-term damage or saving a life. Do you know any other symptoms of stroke that were not mentioned earlier? Let us know in the comments section below.